Markets clearly see the risks from coronavirus as exceptionally high, but should we be worried about it from our health perspective? Dr. Anand Parekh is the chief medical advisor at the Bipartisan Policy Center. He spent a decade at the Department of Health and Human Services, where he was a deputy assistant secretary. He's in our D.C. bureau this morning. Good to see you, Doctor. President Trump, a big speech earlier in the week suggesting that Americans shouldn't be too worried about the coronavirus, but we did see potential cases in California tick up. Should people be worried?
Well, Brian, you always have to hope for the best, but you absolutely have to prepare for the worst. And I think the critical piece here for the American public is not to panic, but to be prepared. Now, the 60th case in the United States in California is worrisome. It's an individual who does not likely have exposure to someone who was infected or is not a travel-related case. So we aren't quite clear exactly how the individual contracted this coronavirus. And so public health right now is trying to investigate exactly how that individual was infected. So I think the worrisome piece here is there potentially community transmission ongoing in the United States? And one of the things that's being done right now is testing of more Americans. We have a laboratory test that's now working. So we need to test more Americans who may be infected to get a better understanding of how many people in this country have the infection.
Doctor, you were at the HHS during the swine flu of 2009, during the Ebola outbreak of 2014. I'd like your take on what you make of Vice President Mike Pence sort of leading the charge in this country, leading that team responsible for the coronavirus effort. While governor of Indiana, a lot of people criticized Pence for sort of dragging his feet during the HIV outbreak there. It took him weeks to respond and provide a program to get fresh, clean needles to intravenous drug users in affected areas there. So what do you make of Pence being named that?
Certainly, White House coordination and leadership is absolutely critical. I think for the American public, however, at the end of the day, this is a scientific issue. This is a health issue. And it comes down to trust between the government and its people. And I think at the end of the day, most of the public want to hear unfiltered information from scientific experts and medical experts. So regardless of who is in charge, and I do think the organizational structure there at the White House does need to be clarified, I think what is even more concerning is this idea that any public statement related to the coronavirus has to be cleared with the communications office in the vice president's office. And I think that is concerning because, again, I think the American public want to hear unfiltered scientific and health information from our nation's leading scientific and medical experts and not potentially hear it through a political lens.
Doctor, do you think we are at the point now where the Trump administration should step up and lock down or just halt international air travel?
Well, so microbes know no borders. I think that's a really important point. And certainly right now there are some travel restrictions, and I know the CDC is actively looking at that. But we are getting to the point now where we are realizing worldwide that even though we want to try to stop transmission chains, we may not be able to contain this virus. As you've heard in your report, nearly 50 countries have cases now. This is now out of China, and we've seen an explosion of cases from Italy to Iran, to South Korea, to Japan. So this idea that we're going to be able to use travel restrictions to not allow the virus to enter in the United States, that's just not going to work. What we need to do is continue our containment efforts, but really plan for community mitigation. And that's really what the CDC is stressing. All sectors of our society and communities need to think about what happens if the virus spreads in their community. So it's not just about stopping transmission chains now. It's not just about travel bans or restrictions. It's really about community mitigation. And I would say, Brian and Alexis, again, I think the key point here from a health perspective is to get away from the P word of pandemic or panic. The P word has to be a focus on preparedness, whether that's individuals and families and hand hygiene and social distancing, whether it's schools, workplaces, employers, organizers of mass gatherings, thinking through what would need to be done to reduce the effects and exposure of the virus in a community, to critical infrastructure like law enforcement and transportation, to our supply chain. Obviously, our vaccine manufacturing industry is trying very quickly to come up with a vaccine, but it's really preparedness, not just all of government, but all of society. That's really where our focus needs to be right now.
Doctor, really quickly before we let you go, I see a lot of people walking around with these face masks. Should we be doing that? How effective are they?
No, you should not be walking around with the individuals who need face masks are those individuals who are infected or healthcare workers or those who potentially have been exposed. But if you are a healthy American, you do not need to be walking around with a face mask. Face masks do need to be stockpiled by the U.S. government. That's part of the emergency supplemental ask that the administration has made to Congress. We will need millions of face masks, but at this time, if you're the worried well, you should not be either stockpiling masks or wearing them in public.
Dr. Anand Parekh, thanks so much for your insights this morning. We appreciate it.
Thanks so much.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.